to come out. Thank you very much. We're really lucky to have you.
Thank you much. It's a pleasure to be here, and I thank you very much for the invitation. I'm trying to get myself set up is what I'm doing right now. So just give me 1 second because I just got the screen share.
No worries at all.
So hold on. Can everybody see that? Is that okay? Are we good?
It's beautiful. Yeah.
Excellent, excellent, excellent. Okay, so here we go. So thank you for the invitation and hello. And I'm pleased to be doing this, and I'm actually really looking forward to the conversation. I thought before starting, I would try to give you a sense of where I'm coming from, which is that it really seems right now with the pandemic affecting us, not only here in LA or in the US, but actually in all parts of the world, that we're really at a crossroads. Not only in terms of COVID, but in terms of what it is showing us about the fault lines that exist in our societies and the commitments or the lack thereof, to be honest, to do anything about it. And so that's the concern I bring to this talk. And I hope maybe we can come back to that in the conversation at the end. So I have to be honest, whenever I'm going to talk, I want to know what people are going to talk about. So here's the outline of what I'm going to talk about, so you know kind of where I'm going and kind of what's there. So I thought the best way to start this was to begin by defining my terms, just really broadly, so you know when I say things what it is, what I mean by those things that I'm saying. And so when I talk about global health, what I want to be clear about is I'm talking about moving past looking at health problems, not only in relationship to our own country or to our own experience, but each of these issues brings up, I think, different sorts of issues that we need to think about in terms of how we think about addressing the virus, which is really about collective action and about support for issues that transcend national borders. So it's a broader framework than just looking within LA or within California or within the US, but really seeing ourselves as part of the globe. And as far as global governance, which I think is key to being able to think about how we address this, these are really kind of to get into our heads the range of actors that are responsible for trying to address these sort of collective challenges that we have. And the UN, the United Nations, is clearly the actor most responsible for kind of coordinating all these pieces, but not only, and this is what's key, not only for health, but for the promotion and protection of human rights. And so having said that, I feel like I need to say, okay, what do I mean by human rights? And I mean what the UN means, that they are internationally agreed to, and that they're about the relationship between the individual and the state, and that they set out what governments can do, cannot do, and should do for us. So what I'm getting at is that it's not just using the words rhetorically, it's using the words in a real way in terms of where there's some level of legal obligation. And in terms of the legal obligation, again, it's about what the governments of the world have agreed with one another that they are responsible for. And so it's about the legal obligations that they have together to promote and protect rights. And I'll just give you an example of why I think that that's so important. Pompeo, the Secretary of State under Donald Trump, put together a commission which attempted to redefine human rights according to US values. And he called it a Commission on Unalienable Rights. And I have to say, it's one of the first things that Biden got rid of on day one. But I just to be clear about this nationalizing of an inherently universal concept like human rights is really dangerous. And so I raise it here because I think I want to be really clear that when I'm talking about human rights, it may not be everything I want it to be, but it's what the governments of the world collectively have agreed. And so that we take that as the framework. These are the treaties that the governments of the world have agreed to be bound by, and they're important for us to be able to understand what are the rights that we are able to claim from the governments and the countries that we're in. For those of us from the US, it's a question for you. Do you know which treaties, human rights treaties, the US government has ratified and which ones we have not? We can talk about it at the end, but I put that to you in terms of just to know that is something you absolutely should know. And I will say for those of us on this Zoom for the United States, we're kind of an outlier that we're the only country in the world at this point that has not ratified the Convention on the Rights of the Child, right? So just for you to kind of see where the US sits, but that's another story for another time. All right, in terms of the rights that we're talking about, so now we're really starting to move into thinking about COVID. And I want to ask you to think about how many of these rights do you see as relevant to the underlying determinants of health, of who's getting sick, to supporting people not to get sick, and once they're sick, if they do get sick, to getting the testing, the care, the treatment they need, to getting a vaccine, to supporting people on the road to recovery? Do you see how many of these may be relevant to the current pandemic? And then I ask you, how many of these from your current experience are actually being protected? Think about what you know from what you read, think about the media, think about the governments of the world in terms of the context of the pandemic. And it certainly isn't the case in the US, the majority of these rights are being protected, but I would ask you to think beyond the US as well in terms of what this means. So let's go beyond the current moment and think about what's happening around the pandemic for individuals, for communities, for governments, and for the UN system in terms of their responsibilities for health and human rights. And I thought it would be good to start with ourselves first, before talking about others. Like, how are we all doing? Right? Let's think about this from the perspective of we're all in a very privileged place, right? We are privileged in the sense of being able to be together, to be able to connect on the Zoom call, and think about from our perspectives how difficult this situation is, how difficult it is for all of us in terms of thinking about physical distancing and mask wearing, and living with the safer at home orders that those of us are dealing with in LA, and think about mental health and how your own mental health is doing. And I don't think I'm going out on a limb by saying that for all of us, this has been a really, really difficult period of time for everyone, and that everyone is finding this to be super stressful. And so thinking about that, these are kind of the directives from WHO about what we're all supposed to be doing, kind of in an abstract sort of way. And they seem like a good idea in general, but let's talk about how this plays out in practice. And I want to focus in particular on physical distancing. Now, take a look at this, right? This seems from a public health perspective a good idea to suggest physical distancing. You can imagine the health officials who were making this decision because of their perception of what's needed to maintain the health of the community in the context of the virus. You can totally imagine the conversation, at least I can. Let's restrict the number of people who can travel at any one time to keep people safe until you see its actual effects in terms of communities, in terms of societies. And it makes it really clear that it's much more complicated than thinking about the virus in terms of just a health directive and just to think about it in a vacuum, but we have to see kind of the broader picture of what's there. What do you think it takes for people to maintain physical distancing, to be able to tell people to stay 2 meters or 6 feet apart? What does it mean if you live here? How in the world do you make that happen when you live here? And just to take this a little bit further, remember how I said, like, how are each one of us dealing with all this, and in terms of thinking about shelter at home? This is happening in real time for real people everywhere in the world. And the directive is actually don't leave your home for weeks at a time. But like, there's a lot of what ifs that I put up here. But what if you can't stock up on food? What about if you're living with an abusive partner? Or you need to get your medications, or any of these things? What do you do then? How do you live with this? And let's think for a minute within relationship to this about what it is that we expect governments to be responsible for when they put these shelter in place orders in place for us to be able to survive. What does it actually mean if we need to have access to water, to sanitation, to medicines, to alternative sources of income, to enough space to live? What is it that the government is responsible for doing? What sort of resources do they need to have in order to put these things in place for all people, no matter how poor or how vulnerable? Is it feasible? And think about how much of this goes beyond the purview of a Department of Health. Do you agree then that addressing the virus comprehensively is more than just a health sector issue? And so I want to just get us thinking about that for a minute. Just start with kind of what it takes to think about from a health perspective. To start from a health perspective in any country, how well is this being done? Are all people getting the same access to testing across the board? Certainly not in LA, right? But if you can think kind of across the globe, we have huge discrepancies in access to testing, to PPE, to ventilators, to needed medicines. And then there's an issue with healthcare workers that I want to raise. South Africa just announced that 35,490 healthcare workers have been infected with COVID and 338 have died. Here in the US, the latest numbers show us 3,000 have already died. And so what I'm saying here is that this is healthcare workers who got sick taking care of people who are sick. And the reason that I'm raising it is that in all cases, we need to be thinking about the inequalities that this raises about who are the people who are taking care of other people, who are being able to access the testing that they need to know that they're sick. But also you can think in terms of all of this and in terms of trying to make all of this available, what is it from a government's perspective that's needed to make this real? To go from going that it's a good idea to make testing or vaccines available, but to ensuring that people actually have what they need. Purely at the level, let's start at the level of what it takes to make this happen. There has to be science and there has to be evidence behind the public health decision, right? To start with. Okay, then the regulation has to be passed by a body that has the authority to do so. Then there have to be financial resources that have to be allocated, right? Then you have to have what you've done distributed to the people that need it. Then those who are responsible for implementing it, have to know how to do it, have to have been trained appropriately. And then the general public has to know about it in order to come forward and use it. You see, that's a lot of steps, right? There's a lot of different pieces to make this work. Well, normally in the course of things move slowly. In the context of COVID, things have moved ridiculously quickly because the pandemic is real and there's a real urgency. Just in terms of procedure, consider that to get things through quickly, that senators and ministers in countries around the world have very often followed the most urgent form of parliamentary procedure. And what that means is that these new regulations they put in place are not subjected to parliamentary scrutiny before they come into force, and typically very little afterwards. So in many cases, there's only been a really short gap even between the making and publication of regulations and them coming into force. In some instances, I'm not kidding, as little as 1 hour. Okay. The most recent regulation in the UK, for example, that is imposing quarantine obligations on travelers arriving from overseas, they were made at 11 a.m. on Friday, February 12th, to come into force at 4 p.m. the following Monday, right? So even though the outline of the policy may have been under some consideration for some time, think about the change in the law, what that meant for travelers, for hotels, for insurance companies, for people just in general in terms of thinking about those responsible for implementing it. And think about the fact that all of these then fell into law, so that if you're not complying, like what are all those pieces and how do you make that work? So now we need to think about, okay, beyond that, look at all the other things that countries are doing. And I want you to think in each case, what evidence, what science went into making this decision? What were all the steps that were taken in order to implement them? What part of the government is responsible for putting them into place? Is it the health department? Is it the police? Is it the military? And again, I want to start from the perspective that governments are trying to do the right thing generally in an impossible situation. But I just want to give you some sense of how this is playing out in practice. And other than the US, I'm not planning to name any specific countries, but it's easy to look this stuff up so you'll know exactly what I'm talking about, okay? In one country, 1.3 billion people were mandated not to leave their homes for any reason for 3 weeks. In another, more than 25,000 people have already been detained for not complying with quarantine orders. Across the globe, we literally have seen hundreds of thousands of people who have been detained for not complying with COVID-related orders. And in several countries, we know that thousands of people have been beaten by the police and arrested for not complying with COVID orders, but then immediately let go after being beat up because they didn't have the facilities to hold them once they'd beaten them up. In Texas, a few weeks ago, 230 people died of COVID who were in correctional facilities, but 80% of those people were in pretrial detention, meaning they had not yet even been convicted of a crime, okay? So within the same week, In one part of the world, a man was found beaten to death hours after he was arrested by police officers for not wearing a face mask in public. And in another side of the world, a woman was also found beaten to death by police for the same reason. Now, there's a huge number of countries that have passed emergency laws that punish people for potential or perceived COVID exposure. That's as opposed to actual exposure, so it's just the potential for exposure. And people can be prosecuted for an offense including assault, attempted murder, or murder. So there are literally hundreds of people around the globe right now who have been charged with this offense. And just the way the penalties are written in the law is incredibly intense. As one example, the law says anyone found outside breaching the COVID lockdown can face 21 years in prison. Okay. So in several countries, again, spanning different regions of the world, healthcare workers who've been speaking up about the virus, and particularly the inability of the health system to handle the cases coming in to the press or on social media, have been arrested, charged, detained for spreading false news or for terrorism. And I want to end this part of this by talking about contact tracing, using phone apps for a moment. This has been introduced as part of the coronavirus response in many places. But the question is, should this be permanent? Contact tracing is incredibly important to controlling the COVID pandemic, but what does it mean that these data are being collected? What's happening with the data that are gathered? Who does it go to? And what does it mean for monitoring people's movements and contacts over and above the specifics of COVID? If cooperating with contact tracers might mean getting surveyed by the police, a study was done in New York that showed people wouldn't cooperate, but it's happening here anyway. On a more basic level, in another country, there's an app that's been working really well for monitoring and contact tracing during the virus. But the question is now, should it be taken off people's phones now that the virus is more under control? The government is arguing that it should be kept so the government can track people's personal health status, contacts, and lifestyles in the name of public health. What do you think about that, right? Is the virus is no longer a threat? Who should have access to this information about our personal lives? And who should decide? And there's ways in which the virus has been allowing politics to be played out. For example, in shutting down health services, even if they're provided for in the law, simply by deeming them non-essential. And again, my example here is Texas, which shut down all legal surgical abortion services on the grounds that they are not immediately medically necessary. The Texas decision was made because, and I'm quoting here, stopping abortions will free up the demand for personal protective equipment like gloves, masks, and gowns. Now, Planned Parenthood has filed a lawsuit already, but this is an example of where a state has used, a governor has used the pandemic, a global health crisis, as an excuse to try to end abortion access. But these things are happening the world over. And I literally have hundreds of examples I've been collecting from around the globe. But I just show these to you to get you to think about what these mandated COVID-related restrictions look like. And I ask you to think about, what were the steps taken to put it into law? How is it financed? Who's trained? Who's responsible for implementing? What are the human rights impacts? And this is the key issue I want you to think about. How effective is it, not just in political terms, but truly in public health terms? So when you think about this, like why or why not criminalize the failure to follow health directives, or why or why not criminalize coronavirus transmission? And it's something we can talk about in a minute. I do want to say, going back to human rights, that human rights offers a framework for being able to think about how these things come together, and a framework for being able to think about when is it appropriate to restrict rights so that it's not a violation of rights. You can interfere with freedom of movement to institute quarantine or isolation for COVID. That's a really real example, but you have to follow all of these criteria for that to work. And I ask you again to think in terms of governments, is that what's happening right now or not? Okay. And so there's always a balance in terms of government when they're trying to do this, because different parts of government may have really different ways of thinking that a restriction is right or that it's legitimate. What matters is the process. And, you know, making these sorts of decisions requires some sort of dialogue. Look at this example from Ohio, where you really see two different parts of government having exactly completely different perspectives on what's appropriate or not in terms of thinking about addressing COVID. And I'll give you another example that illustrates this point. The government in another country has plans to make public the names of all people infected with coronavirus because the pandemic is contagious and notifiable. And at the same time, they have regulations in place that make it criminal to disclose anyone's status. So do you see the conflict I'm talking about here? Like in terms of the laws that are there? So there's two laws that are basically saying opposite things. And I'm asking you, who decides according to what criteria, and what does it mean for how it is that we live our lives? Right? So to close this section, I'm just asking you to say, okay, the virus is a public health issue. Think about it. Should it be regulated by health law, by criminal law, by police law, by emergency power? And who should be responsible for enforcing it? What sort of training do they need? What sort of resources and support? And I'm not saying any one is more correct than another, but we need to be looking at these criteria in each case and making decisions based upon evidence, in particular, whether this is having its desired public health impacts. I just want to give you a couple of words about global norms and standards, because that's how governments are supposed to make their decisions. They are supposed to make their decisions upon agreed upon global frameworks about how it is that they're going to address the virus. So the international health regulations, which are in place, are supposed to govern all of the responses countries take to being able to control pandemics like the virus. And on the positive side, you can see there's some attempt to think about the ways in which multilateralism is relevant and the ways in which the protection of human rights is key to being able to do this. But this has not been enough, as you can see from the examples that I've given you, right? So going back now to March of 2020, I just want to say, going all the way back to that point, we have UNAIDS being the first, who's the UN body responsible for the HIV response, being the first one to basically say, look, we have 40 years of responding to the HIV epidemic, which has generated significant experience that basically says you have to protect human rights or you're not going to be able to control the virus, right? So that's March of 2020, right? And it's you can clearly see a lot of governments have not heeded that advice, right? In the same month, or just a few weeks later, in April of 2020, you had the World Health Organization take it one step further. And it's important because it's the World Health Organization, because what that means is that they're basically saying you have to pay attention to human rights in order to reach your public health goals, which is, I think, fairly contrary to some of the examples that I've shown you in terms of kind of what's happening around the world in general. And again, in April of last year, and I keep wanting to say of last year because it's really important here, is that you have the United Nations Secretary General saying that country after country around the world is actually using this public health emergency as an excuse, right? And that basically what you have is you find this is turning into a human rights crisis, not just a health crisis. Okay, so to wrap this up now, just to start with wrapping this up, I think it's undeniable, I hope you'll agree with me, that human rights matter for the COVID response. There's a legacy there, it's important, we need to build on that legacy, and we can't abandon it. And as we move forward, we need to think about the questions paying attention to human rights offer us. What ultimately can paying attention to rights offer as we think about COVID and as we think about its legacy on our lives, on our institutions, within our communities, within our countries, and just globally. And how do we make sure that our responses to the pandemic, right, are in the future seeking to optimize both public health and human rights, not just because it's the right thing to do, but because it's the most effective. And it's what we've learned from HIV, and one of the things we shouldn't have to keep reliving each time. So what is it going to take to get us there? And these are the couple of things I want to leave you with in closing. These new harmful COVID laws have got to be challenged. Some of this is starting to happen, but it's going to need to really be a focus in the next few years. We have to document the harmful impacts of these bad laws and the positive outcomes of good laws in the context of COVID, and then do everything necessary in order to actually make sure that these bad laws can be repealed, because they do more harm than good. And as most of you are students, I want to ask you to help us all gain a better understanding of the relationship between these sorts of national emergency legislations and the specific impacts that they have on people's health in the context of COVID and beyond. Do these kinds of policies and legal measures help or hinder public health? What's the evidence you need? And I would love it if this was something you all were interested in studying and documenting and thinking about kind of moving forward. COVID has really raised awareness about inequalities in global health, and that's a good thing. And I think it's made it really undeniably clear that public health, especially on a global scale, well, and on a national scale, cannot be separated from politics. And we have to be vigilant about this. We have to watch the ways in which national security and the meaning of national security is being recast. What does it mean for health and security to become so intertwined? Right? Is it okay that the outbreak has allowed for the architecture of surveillance and social control to expand in the name of public health? Is that something we want? Is it something that we really want to work for or move to change as we go forward? And I think recognizing health and rights in this way moves us away, I hope, from some kind of simplistic solutions and towards what it's going to take to address the underlying determinants of health that have always been there, because it's the right thing to do, but also because it's the most effective in public health terms. And I want to end with two things I'd like us to discuss, which is that COVID is a reminder not only of the global connectedness of the pandemic, but also of its collective solutions. And in response to all of the commotion about WHO's role at the start of the virus, several months ago, the WHO Director General created an independent panel of pandemic preparedness and response to evaluate the world's response to COVID. And the kinds of things that I'm talking about here. And it's co-chaired by two amazing women, the former Prime Minister of New Zealand, Helen Clark, and the former President of Liberia, Ellen Johnson Sirleaf. And they've presented two interim reports, and they're going to present a final report by May. But there's a real attempt there at transparency and accountability, and we're not quite sure what they're going to recommend yet, but the point is that is a framework that we can all use to kind of move stuff forward. And a major concern for them, and that's where I'm going to end, is on the inequitable access to COVID vaccine. And as the co-chairs themselves have said, a world where high-income countries receive universal coverage, while low-income countries are expected to accept only 20%, is the wrong footing, both for justice and for pandemic control. So let's just say a few more things about the vaccine. All right, it's clear, we know, the pandemic will not be over until it's over for everyone, everywhere. That is from both a public health and a human rights perspective. And within the US, we already know that things are a mess. I don't know if you saw this in the New York Times, but on Tuesday, New York City released a report that underscored incredibly troubling disparities in the city's vaccination efforts, with the share of residents who are fully vaccinated in some wealthier Upper West and East Side zip codes, which have a high proportion of white residents, reaching up to 8 times the rate in parts of the city that are predominantly Black neighborhoods like East New York. That's locally. Now let's talk globally. So vaccines are often thought of as a tool to achieve global equity, and global health diplomacy has generally focused on ensuring universal or equitable access to vaccines for low and middle income countries. In the COVID-19 pandemic, however, the wealthiest nations have not been uplifting the poorer ones. It's been well reported, I think, that wealthy countries, not just the US, have been pursuing a me-first approach to vaccine acquisition and distribution. Nearly 4 out of 5 high-income countries have already begun vaccinations, but 130 countries with 2.5 billion people around the world have yet to receive one single dose. Okay. According to the most recent data that was collected by Duke University's Global Health Innovation Center, high-income countries, including the US, have secured 4.2 billion doses of COVID vaccine compared to only 670 million acquired by all low-income countries together. And what's being called vaccine diplomacy has become a means of cementing spheres of influence with rich countries donating vaccine first to countries they see as strategic partners rather than those who may need it most. And experts really worry that this approach, which we're calling now vaccine nationalism, is going to leave many middle and low income countries without widespread access to vaccines until 2022 or even 2023, prolonging the pandemic and its effects on everybody's lives. And purely in economic terms, if you're an economist and have that sort of framing, there's a study by the International Chamber of Commerce that shows that even fully vaccinating the populations of rich countries while neglecting poor ones could cost the rich countries as much as $4.5 trillion in lost economic activity. So the pandemic is really only going to come to an end if it's tackled around the world. And equitable access to vaccines is essential. Vaccine allocation cannot be this zero-sum game. Vaccine nationalism is not, in my mind, just morally indefensible. It's epidemiologically self-defeating and it's clinically counterproductive. There are many steps that can be taken to ramp up vaccine production and broaden distribution. I can go through what those are, but just to say that it is essential that we actually pay attention to vaccines for the whole world if we're truly to achieve health equality, let alone global health security. In a deadly pandemic like the one we're living in right now, I hope you see how the rights to health and life are really bound up together. And with all that's going on to get the virus under control, I hope you see with this how the law is critical for the COVID response, whether to ensure people have access to testing and to vaccines, but also to enforce stay-at-home orders, mandate social distancing. But we've also seen the misuse of the law and the misuse of police power and criminal law. And we've seen the very real effects on all of our communities and the effects on real people's lives of people who are unable to pay their hospital bills or their rent because they were sick or they're out of work, while other people and businesses are flourishing. It's incredibly deepening of the divisions between the haves and the have-nots in ways that are going to impact the world for decades to come. On scientific, humanitarian, and human rights grounds, we need a major effort to create a comprehensive, equitable global approach to addressing all aspects of COVID in terms of prevention, care, treatment, vaccine production, affordability, availability, deployment, you name it. A true global response has to be based on true global human solidarity. It's not just a nice idea. At this point, it's a necessity. And I really hope all of you will join me in doing all you can to help make this a reality. Thank you.
Wow. Wow. Thank you very much. I really appreciate that. That was beyond informative and eye-opening, and I'm almost starstruck in a sense. Thank you so much. I think it just goes to show, especially as a student, not just at a university but at USC, how privileged we are and how we constantly lose track of that. I know all of us here, we try to give back and we try to help, but to be in the situation we are still learning issues like this that are so massive, yet at least personally for me, my knowledge about this is so little that it's so important to constantly be challenging ourselves and questioning our actions and making sure we're moving forward with others in mind. That said, I love to open it up to kind of a Q&A, comments, a discussion, whatever everyone feels comfortable in sharing. And I'm just happy to start that off by just kind of opening up a question or comment to Dr. Gruskin / everyone else. when we talk about, or Dr. Gustin talked about this kind of intertwine between public health and politics and the criminalization of these breaking COVID rules, when really these rules, this criminalization is targeted, whether it's a type of systemic injustice. It's targeted at people of color, people who are so-called underprivileged. And we talked about how there needs to be this intertwine of public health and politics, yet the people who are making these rules, there's no diversity at the top, right? Or at least very little. When we talk about they're primarily white individuals, and if you want to take it even a step further, primarily men, right? So there's a lack of diversity in both age, gender, and ethnicity. And I guess the question / comment is the final point: how we can begin to advocate that, or advocate for change in that at a public level, or from our, I guess, position that we don't necessarily have a foot in politics, is what I'm trying to say. How do we begin advocating and changing that? Yeah.
I'm happy to respond, but I'd love to hear other people's thoughts first.
I have a question. I think in the beginning you mentioned that the U.S. has only ratified if to my knowledge, it's only 3 of the 9 core human rights institutions or human rights treaties in the world. Why do you think that the U.S. has only ratified so little, and why are we lagging behind in the sphere of human rights?
Well, I will respond to that. I did want to give space for the question that came before, but I'm super happy to, maybe I'll respond to the first point first, and then the second. I just, in the first piece, I just want to say, I think that in response to your question, I think it's not only about age and gender, it's about class. We really need to recognize, and it's not only about race, ethnicity, it's all of these things together. And I want to make sure that all those pieces are kind of in the package. And I think in terms of the first point, I would only say we need to own and recognize our privilege, right? We just need to own and recognize it. That doesn't mean that we need to be quiet. It means we need to know it, and we need to recognize the space that it gives us, and we need to make sure that we also open space for others who don't have it, right? So it's an action that will, I hope, be something you do your whole lives, not just in this moment as students, right? And so I just want to just kind of respond to that, and others may have other thoughts as well. In terms of the very specific comment, and I'm really grateful whoever asked that you know which ones the US has ratified, because that's not always the case. So fantastic. And so there's a couple of things. So one of the things that I think is important to say is that in the United States, it's a 2-step process to ratify a human rights treaty. You need the signature of the president, and then you need the advice and consent of 2/3 of the Senate. So there's a 2-step process, and they don't have to happen the same year. They can happen kind of over decades, right, in that way. And so one of the difficulties has been that in the US, often there's been an unfortunate approach to the fact that there's a distinction made between what are called civil and political rights and economic and social rights. So that you have a right to be free from torture, potentially, but you don't have a right to healthcare or to education, because those are thought to cost resources and to cost money. And I actually think it's a false argument, which we can talk about it if you want. But the point is that's the political way that it happens. And so as a result, the treaties that as a US we've managed to ratify are those that are about civil and political rights, not those that are about economic and social rights. And the reason that we have not ratified the Convention on the Rights of the Child, there's a number of reasons, but one of them is because it is a treaty that was actually drafted after the end of the Cold War in early 1990. And as a result, it's much harder to distinguish what is civil and political and what is economic and social. And therefore, the US government doesn't want to be bound by it. So to give you the very quick example on that, because I think it's very telling, the right to life in a civil and political way is understood to not have your life arbitrarily taken from you. That's something the US government can get behind. But the right to life as it's written in the Convention on the Rights of the Child also includes our right to survive and to develop, right? And survival and development means that there's economic resources that are engaged. So it's harder to disentangle, which is why the US remains an outlier. I hope that answered that.
Yeah, thank you. That was really helpful.
But also, just going like back to Sam's question, I think there's power in people. And so even if like you're not, I mean, obviously like I'm not a white male privileged enough to like work for governmental agencies and have all this political power. But they're still like at the ground level where like all the real work is done, that I think is like the main platform for like making big strides and having changes. And you have like all these smaller like advocate groups, I guess you could call them, that like who recognize the privileges at the top, right? And then they just have the power trickle up to the top and start at the base. And I think like at this point, especially with dealing with the pandemic, that's probably the best way of working around like all of the political, I guess, like roadblocks and like red tape that we'd have to get through and all of the inequities. I think if we just like focused on the bottom where the people who are actually going through the problems and experiencing the struggles, and like the lack of privilege, I think that's where the power comes from. So that's my take on it.
And don't you also see, I mean, it's kind of what I was trying to say early on. We're all going through this with the pandemic, right? Everybody is having a hard time, right? And if you think about your level of hard time and my level of hard time, and then the level of hard time of people who have not the privilege that we all have, it just compounds, right? And I would say that even those people who are in decision-making positions, of high-level decision-making positions, they're having a hard time too. So I also don't want to pretend that it's not, right? It's a difficult moment right now, right, for everybody. And I think this notion of global solidarity, I don't want it to sound just like it's pie in the sky. It really is about like, how do we understand and support and recognize each other through all this? And I think if there's ever been a moment we need to do that and have empathy for everybody, I think it's at this place. I think it's the only way we're going to move forward. I don't know if that resonates with you, but that's kind of how I think about it right now.
On the topic of taking into account multiple perspectives, I feel like doing that in a constructive way is also time consuming. And I think a big constraint this time was that everything had to be rushed. And maybe the lesson is that we should anticipate this in advance and like be ready to implement these policies. But so how do you see that trade-off playing off when like all these organizations or institutions were trying to scramble to come up with policies when this struck?
Totally. And just on that point, I mean, what's interesting is, hindsight is always 2020, right? But the point is, people have been saying this for decades, right? For decades, there is a virus coming. This is happening. I mean, even in the context of the US, as you may have heard, former President Trump, one of the first things he did when he came into office was dismantle the department that dealt with global health and pandemics, because there was a concern that it was a waste of money, right? But that's not unique to the Trump administration. That happened everywhere, right? Because money is tight. And so there's this question about how do you do that? So my hope is that exactly what you're saying, that we learn from this time. Even though we didn't learn, we have consistently not learned the lesson. So maybe this time is extreme enough and global enough that maybe we learn it. I mean, I hope so. And you all will be in those positions, right? 10 years, 15, 20, 25, 30. Like, will you remember this, right? Or, what trade-offs will you make and how will you think about it, right? So I'm totally with you.
Something I wanted to add is that all of these politicians that are in place, they are there because they're meant to represent the values of the people who put them in power. And I think part of keeping them in power and holding them accountable is making it clear what our goals are and advocating for that really strongly, because if they want to stay in power, they have to do what we're asking of them. And so being really clear in what we want, or at least following specific values, will give them guidelines for how they approach the problems they need to solve when they're in their political position.
And I hear you. And then we have to think about then, what are our goals? Are we ready to put aside, for example, our access to vaccine if healthcare workers in poorer countries have not yet been vaccinated? Or at what level? Do you see what I'm trying to say? Like this whole question about how we determine, like how we think about. So it's not, should these decisions be made? There's no easy answer, but it's really a question about how do we make sure that we continue to have these conversations, right? And we make sure that we're all having these conversations. And I think from the perspective of a policymaker, I can well understand that if you're a policymaker in the state of California, you want for your people, right? You want for your people. That makes a whole lot of sense to me, right? That's what you're trying to do. At the same time, what if your people, the chances of infection, because you're talking about adolescents, is much less in terms of the harms than the healthcare workers who may die in another country? Are you ready to give up your vaccine? Probably not, right? So how do you work with that? And how do you work with those things? It's not easy. Right? I'm in total agreement on the point. It's just on the practicalities that we need to think about. What is the take? And what I believe is that human rights law and human rights standard give us a framework for trying to make those decisions, for thinking about those processes so that they're not just random. Does that make sense?
Yes, I was going to say, to your point about creating frameworks, I think once we have a system in place, it's a lot easier to make decisions rather than scrambling to fit the current values at whatever moment in time they're at.
Totally with you. Totally with you.
One thing I'd love to add then is, given the fact that I think there needs to be a prioritization of who does get vaccines, whether that's healthcare workers, and then the allocation to countries who, you mentioned the fact that there are 130 countries who have still yet to receive a single dose. That struck hard with me. And in regards to this prioritization, how do we almost teach others around us to empathize with unfamiliarity, or to teach unselfishness, so that there can be a willingness, not just an overall comment we should do this, but a willingness by the public, not just people in power, but willingness by the public to give up their positions or their vaccine that they have access to, but hand it off to those who we ought to prioritize.
I mean, there's no easy answer to your question, right? Obviously, right? So, but I will say that one of the reasons I gave you the economic argument was precisely because that's what can speak to a lot of people who don't have it from an empathy perspective. But if you have the economic argument, the International Chamber of Commerce, right? There's a $4.5 trillion loss in economic activity affecting richer countries if people in poorer countries are not getting the vaccine. That, to be honest, that's not language that speaks to me, because that's not what I'm about, right? But that's language that speaks to some of the people I'm trying to talk to, right? And so it is about also recognizing what's the language that you need in order to be able to make the case, as long as you're solid in terms of what's needed. Does that respond to you in a way, in terms of kind of what you're saying?
Yeah, absolutely. So I get what you're saying, is that not everyone will see empathy or prioritization in the same light that we do, and sometimes there needs to be a reworking of the way we try to, I guess, pass a message on to someone else. And if that has to be through trying to understand or get them to think of it in a selfish aspect that will still benefit them in the long run, then that needs to be done.
Yeah, I mean, that language of enlightens, what is it? In selfish, what is it? Enlightened self. Do you know what I'm talking about? Anyway, it'll come to me in a minute what it's called. But it's this idea of precisely working with people in terms of being able to get them to take people where they're at. But the one thing I want to say in terms of this that becomes incredibly important is you've got to have your facts right. You've got to have your data. Right? It can't be just an altruistic kind of idea. It has to be based on data. I spend a lot of time, like when if any one of you had said to me, okay, tell me the law that you're talking about, tell me the whatever, I got it, right? And it's because I recognized early on when I was at your stage of my career that it was really important to be able to speak not just from the good works I want to do, but from the data that is irrefutable. Right? And so you really have to know what's there to be able to work with it. Does that make sense? Does that, Somebody just wrote, yes, enlightened self-interest. Thank you. That's exactly the words I was looking for. Exactly. Enlightened self something. Yes, exactly. Thank you for that. Other comments?
Towards the end, you mentioned scaling up vaccine production so that it's not zero sum, so that like one person doesn't have to give up their vaccine for someone else to get it. But how do you do that while ensuring like quality control, etc.?
Totally great. Thank you. I think, so first of all, it's about sharing of intellectual property, right? And so right now there are some real issues around some countries and some pharmaceutical companies who are holding their patents and not willing to share the knowledge with other countries and other vaccine manufacturers who could make these vaccines more widely available. So one is about loosening the restrictions on intellectual property when you're in the face of a pandemic emergency, right? So there's also how do you expand voluntary contracting between manufacturers, right? That's a whole other framework that can actually be put into place where you can actually help countries to be able to produce more vaccine and more quickly. In terms of the question about quality control, I think quality control is critical, right? And one of the concerns I think many people have, many of us have, is just that this question about how do you ensure that the vaccines that are being produced so quickly without the level of clinical trials that have been done are going to be as effective as one would hope. And I think one of the things that's exciting about the way in which these vaccines have been developed is the transparency in the data, in the science that's being used in order to do that. And one of the ways in which you maintain quality is you ensure transparency. And so the more transparent pharmaceutical companies are, and the more transparent the entities are that are holding them accountable, the better. Have you heard of the COVID-19 technology access pool? Do you know what that is? Should I say like a word about that? So WHO, along with a lot of other global agencies, and have had signed on now about 40 or 50 countries, and increasingly now trying to move pharmaceutical companies into that group to basically look at pooling resources. It's not just that Pfizer or Moderna or AstraZeneca have the key. It's about pooling resources so that the range of organizations that have the capabilities of producing vaccine can do so. That's how we ensure quality, and that's how we ensure that, and everything then is checked through a global space. Coming back to why I believe so much in multilateralism is that it's much easier to check that if you have a central area than if you just do it for your own country or you just export to someplace else. Does that answer you?
Thank you. Yeah.
I mean, I guess I would ask a question to all of you. I mean, is in terms of thinking about your advocacy and your concerns with social justice and the things that you worry about that brought you to here today, is COVID part of your concerns, or is it something that you see as distinct from the social justice and issues that you work on? So like there's COVID and then there's the work I do, or have they become melded in some way?
I think for me at least, like it's definitely just one and the same. I'm part of an organization at USC, like called the USC Mobile Clinic. And so we work a lot with the homeless population, especially on Skid Row. And like, I mean, I've been with them for like 3.5 years now. So I'm, I guess, like used to all of the, I don't know, just like saddening circumstances that a lot of them are under. And then now, like, you put the pandemic on top of it, and the health outcomes for them are just astronomically depressing, I guess. Like, it's just unproportionately affecting them. And so just like trying to work with, I guess, other healthcare providers and other organizations to give the attention to these people that like honestly need it in the first place, like more than a lot of other people who are getting vaccinated in LA at the moment. It's just, I guess it just like sheds more light on like the same problem that we've already been kind of seeing in this population. And so I guess like there's been a lot of work to get like these free vaccines to all these individuals who otherwise like are left without the resources or the know-how of like where they could get vaccinated. So I think it's just like you see the problem, especially with this pandemic and these underserved populations, where it's not that they're not getting the service, it's the education that comes along with it. Like they don't have the resources or the opportunity to get the resources of where they can even get the chance to kind of receive the same opportunities that are available by all these public policymakers, but the information isn't getting distributed, and that's just like a conglomerate of problems like associated with, I guess, like just the, I don't know, the inequity of healthcare and public policy and education in general. It's just everything compounds. And yeah, working with the homeless community is really just like shed more light on, I guess, like the extent to which all of this can like pervade. Yeah.
No, and I'm really glad you're doing that work. I mean, I guess the last thing I would say about all this is the fact that, you know, you're talking about a very local community in LA, right? And everything you're saying, you can extrapolate out to the next level of community, the next level of community until we get to the globe. And everything you're seeing in terms of this inequity is what we're seeing everywhere, right? Whether it's between, within, I mean, kind of across countries. And I think one of the things that I think is a responsibility for all of us is to be engaged and to do something about it, right? And so why I appreciated being invited to this is that this is a group of people who care and who are active. And so I ask you, I mean, as I sign off, I ask you to be thinking about kind of your next steps and the ways in which the issues that you care about, how that drive your career choices, right? And how that can drive the decisions that you make about how you live your life personally and the kinds of work that you do, right? And I hope that this kind of conversation helps open up some other ideas and some other things to be thinking about. And please do follow us at the Institute on Inequalities and Global Health. We do a lot of events and activities ourselves that I think you might find interesting. We actually have a speaker on Thursday who's probably the preeminent person on decolonizing global health. And basically she's an incredible speaker. And basically her message is really about how we have to take all of these structures and systems and blow them apart. And what is that going to look like in terms of how it is that we think? So anyway, so just to say, I appreciate the invitation and it was really nice to meet you all, and please do stay connected.
Thank you so much. I truly do appreciate it. Really do. Thank you. We will be sending out an email for those who attended, kind of just a nice sum up of what we talked about today. That said, please fill out the feedback form if you get a chance to. And that said, in 2 weeks' time, we have more conversations and talks that are going to take place. Specifically, a talk with Dr. Walters about the nature of public education. So please do feel free to sign up for that if you're interested. That said, have a great rest of your weekend. We hope you're all staying healthy to the best of your abilities, and hopefully we can see you all sometime again. And thank you, Dr. Griskin. I truly appreciate it.
My pleasure. Take care.
Thank you.
Thank you.